We went into the process of the preventions and non-pharmaceutical interventions and the personal protective equipment. We did the socioeconomic lockdowns. The first phase is like they did with Wuhan. They locked the entire city down, then it went down to the entire world became locked down. And we had to stay at home orders. Then we had to talk about again, provision of face mask as part of the personal protective equipment. We talked about improvement in our personal hygiene by increased frequency of hand washing and using antimicrobial wipes and scrubs on our surfaces in our work environment as well as ourself, our person. We talked about social distancing, which I actually enjoyed not having a person shove a grocery cart at my backside and they had to stay farther away from me in line. Those essential businesses. We talked about quarantines and segregation. So patients who were COVID positive went to COVID positive wards. Nursing homes had COVID positive wings, and we segregated those people away from the other populations of risk through quarantine. Quarantines recommendations have changed dramatically from phase 1 now to present day. Initially, it was a 30 days of being quarantined. If you tested positive, it dropped down to 21 days. Eventually went to 14 days and stayed there for the majority of this pandemic. More recently, it dropped down to 10 days. And in the last few months, it went down to 5 days. And I know that academic hospitals in my area of the Midwest were allowing people who tested positive to come on to work anyway because they were short-staffed, even though they were COVID positive and had not been away from the hospital and only had to be away from hospital for 5 days. They were that short of staff, they let them come on in. And now currently in the UK, United Kingdom, if you're positive and symptomatic, there's no requirement for quarantine. 0 days is where it's gone. Again, social distancing, the 6-foot rule, where did that come from? Why was it installed as a recommendation by public health? Is because of the film that you project out of your mouth when you're talking or speaking, a normal speech and normal breathing, you'll project out droplets that can contain virus as far as 6 feet. That's why the 6-foot rule was recommended. If you cough, that doubles to 12 feet. If you sneeze, that goes out to 18 to 19 feet, greater than 6 meters. That's why I think yesterday somebody sneezed and everybody was like, whoa, clear the room. It's okay. We also realized that at first we thought it was spread by droplets, and droplet size would be spread most likely but somewhere between 1 meter to 2 meters. And that's where we started doing this social distancing, because we thought this virus was spread by droplets. It soon became recognized, especially in Singapore, that this was aerosolized. This meant the virus could travel in the air as far as 32 feet or more. So they had patients down the hall that were COVID-19 positive. They checked the ventilating systems and tested those, and they found the virus had been all the way down the entire hallway. That means if someone's on an airplane with you at the very back seat and you're in the first class seats, you're still exposed. Okay. So it was uncontainable. It was unstoppable in that fashion. Talking about sanitizers, I think the best I came up with about 2 years before the pandemic broke out, I learned about this company. It's out of Overland Park, Kansas, and it's called Danilite. It's a hospital-grade disinfectant. It's made out of 2 very rare elements. It's made out of water and salt. It's 99.9% effective against all microbes, whether it be a fungus, a bacteria, or a virus. It even works against C. difficile spores. And it works in a matter of minutes. And it's safe totally in your environment. So nobody's allergic to salt or water unless they're from a different planet. So it's hypoallergenic, extremely effective. It's safe to spray around pets, children, food, beverages. It's safe on all surfaces unless it's electrically charged exposure. So I cannot say enough good about it. It's hypochlorous acid is the active ingredient. It's electrified water with increased oxygen and chloride content, which is the bactericidal, the kills of microbes. And in this case, when I say it's hypochlorous acid, the pH is 6.7, with neutral being 7. It's as close to being neutral as can be. So it doesn't eat up your clothes. It doesn't stain or bleach your clothes or what you're wearing, what have you. It's extremely safe. That's even made to be used as a mouth rinse that has hypochlorous acid as an ingredient to rinse your mouth with and gargle with. Great thing to use when you've been around patients that are sick with COVID, because it's all about your exposure to the viral load that they're going to give you. So if you gargle with this and rinse your mouth with this, then you're going to be protected from colonization of the virus. It's so safe, it's used as eye drops and eye rinses, and it's used as nasal sprays. And I told my patients to take this product back here. Its concentration is 500 parts per million. You can dilute it, as we've seen in the other examples, you can dilute it out to at least 5 parts to 1 with tap water. So 1 gallon can make 6 gallons of ingredient material that you could carry in little Spitzer spray bottles like they show here that you can purchase for them or buy over the counter and fill up with the Danlite. And again, spray everything around your environment. I would spray my keyboards every time I went into work. I'd spray my chairs. I'd spray the floor. I'd spray the door handles, which are never wiped down before I go into the exam rooms. So I was using it, universally all around me. I believe it's a great protecting agent. The other thing, I had the patients go to their drugstores and get one of those nebulizing units that you can get, the nebulizing material, your liquid materials. They can either do the little puffers and do the nebulizing treatments after they've had exposure, have symptoms of a sore throat or cough early on, or where they mask, where they get both the nasal and oral mucosal exposure to this to knock down the colony count. Because what happens is the coronavirus, the COVID-19 SARS-CoV virus, goes into your nasal passages, locks into the mucosal lining to the ACE2 inhibitor, and then it starts climbing down your mucosa pathways into your lungs, into your GI tract. And it's all about the initial viral load. If you were overwhelmed with a huge viral load at the initial onset of your exposure, you're more likely to have a more serious illness. If you could knock the viral load down to a small incremental amount, you had time to allow your immune system to respond and to stop the virus before it became a serious infection. Does that make sense? And so the more you could, again, cleanse your mucosal pathways, especially your nasal passages in your throat and your oral cavity, the more likely you're going to be able to, after you had exposure, you're going to go through it, you're going to have symptoms, but more likely mild symptoms and more likely not end up in a hospital. Any questions about that? So during the time, this came out in September 2020, the announcement came out during the fires that were on the western shorelines in Washington State and Oregon. They had and California, they were having tremendous forest fires. And they told the people, do not count on your mask. Don't count on your cloth mask to stop the smoke particles. I go, okay. If it can't stop a smoke particle, it's not going to stop the virus, a cloth mask. Yet, that's what we're telling everybody to do. If we look at particle-related sizes, the rope-like structure, far right of the screen, that is the size of a human hair. We go down into the micron sizes of a fine grain of sand or salt, to the size of a red blood cell or white blood cells, pollen. There's your red blood cells there. There's your respiratory droplet that can contain the virus inside of it, size at 5 to 10 microns. And then you're down here to the coronavirus right here, which is down to 1/10 to 0.5 micron size. The only thing that's going to stop this size of a particle is going to be a high-grade, well-fitting N95 mask, which were in extremely short supply. They passed them out and rationed them out in the hospitals. You guys all remember that. Did anybody have trouble getting an N95 mask first wave of infection? Were they reserved for only certain key personnel in the hospital who worked in ICU and around very ill patients? Did they actually go back and rewash them and try to hang them up and sanitize them, use them over and over and over again as long as possible? Cook them, put them in a room with peroxide aerosol in the air, ultraviolet light exposure. Only thing we do to make them last longer. Although the problem was, where was the origin of the N95 masks? Where they manufactured mostly? China. 95% of the N95 masks that came over from China were defective. 95% right, defective. They gave us their junk. It didn't work. Didn't work.
How good are the K95? Those K95 are produced in China too?
You wouldn't know unless you took that individual mask to a research laboratory and had it tested. The other thing about the mask, how many in this room, when they got their mask and they got, once you get a qualified N95 or K95 mask, how many were tested for leaks in this room? 1, 2, 3, about 2% of the population here, 2 or 3%. I was tested for leaks. They had to try 6 different N95 model masks. They found one where it didn't leak around the edges. So it wasn't just pick up an N95 and think you're secure. If you really want to be secure, you want to test for leaks around the margins. So the National Center for Biotechnology Information came up with the conclusion that masks don't work. Not on this virus. We went eventually from no mask to wearing multiple masks was a recommendation by the CDC. And Dr. Fauci in particular. But if you read through this language here to the right-hand column, masks are detrimental. They may induce hypoxia, shortness of breath, increase anxiety and depression, cause increased fatigue, decline in cognition. And so overall, this agency came up and said, for many reasons, masks may be detrimental and not beneficial. And there again is a table for all the physiologic and psychologic effects of wearing a face mask. Now, do I believe in masks? Yes, I do. Would I go, every operation room will always have a mask in it. It's the people who should be wearing masks, those people working around people who are acutely ill, those people that are acutely at risk. That's where the mask should be designated to. Yes, sir.
There's a big absurd face masks, plastic jars.
Not when you're talking about an R not a 7. You have to be basically in a spacesuit with independent, filters, HEPA filters that block it from getting into your system. Basically, like you go into a biological lab. That's the only way to protect you from exposure. I remember my first generation doing orthopedic surgery. We basically went into spacesuits. That's how sterile the environments were. We've done a great disservice to our young people by masking them up. We've delayed their development in speech and social skills and social interaction. 95% of our communication is nonverbal by facial expression. And so children, young adults were unable to understand what the meanings were, the content of your words when they couldn't see your full expressions. And so the CDC's response to that was to quietly lower the requirements for word development in young children. It slowed us all down. And these were the people who were bulletproof to the COVID-19 virus. They had no problem with it. Thank goodness. They were spared. The consequences of wearing masks, we were all scared. We were all trying to wear the tightest fitting mask we could on our face, and we ended up with a lot of dermatological problems. And so here's a list of the things that happen from wearing too tight a fitting mask, or wearing masks that's not cleaned or replaced or changed. Ideally, if we had enough masks, you'd change the mask between every room you went to examine. There's no way we had that volume of mask. And so all these dermatological issues were coming out for those patients who went on extended long shifts. They went doing 14, 16-hour shifts because of short supply of staffing. And they end up with some health issues related to that. And this is a little reference you can turn to help you avoid skin damage while you're wearing personal protective equipment. That's a good resource to share with folks who are working in ICU intensive care and requiring a lot of PPE wear for long durations. And just before we got here, February 25th of 2022, the CDC relaxes its mask mandate. Let me speak a moment about mandates. These three-digit organizations, these three-letter organizations, whether it be CDC, NIH, or the FDA, mandates are not moratorial law. They're suggestions. This came out to be very poignantly proven when they had a lawsuit went against the Society for Infectious Diseases on the management of chronic Lyme disease. And they sued the committee recommendation, the doctors who were on the advisory committee were sued by patients who had chronic Lyme disease for their mandates, which blocked them away from alternative therapies. For 10 years, they went through the courts, and those doctors said that changed their life. They will never sit again on a advisory committee on behalf of a healthcare agency. Fortunately, the Infectious Disease Society did provide the attorneys to help fund their lawsuits, which would end up being hundreds of thousands of dollars or nearly $1 million in legal fees to block them from being sued on the management and their recommendations for chronic Lyme disease. The conclusion was by the courts is that these recommendations that are put out by medical societies are not law, they're suggestions. Yet we've acted upon these mandates as their law. We brought them into our hospitals as policies. We've been complicit to these mandates and adopting them without the science to back them up. And we as physicians need to stand up and say, enough's enough. Yes, these are suggestions, these are mandates, these are protocols that are put out there to give us some guidance, but they're only guidelines. They are not the true rule of how we're going to handle an individual patient as we become their healthcare providers. Rules for thee, but not for me. So all these people who were putting these mandates out, where they be world leaders, prime ministers, and presidents, were going and socializing when everybody else was in lockdown. So this event occurred, in July of 2020. Fauci's at a ball game with his mask down on his chin. That's not a hot dog or a drink in his hand, that's his cell phone. Rules for thee, but not for me. We're being violated all the time, whatever was convenient to the interim. And then we allow our southern borders to be wide open. That's just 25,000 seek asylum. We're not over 2 million people across the southern border without being tested, without being screened, without wearing masks. There's nobody in that crowd wearing a mask if you look closely. Nobody was tested. Nobody had a PCR nasal swab, the back of their nose and down into the pituitary, screen them, and none were vaccinated or tested for vaccination. Blocked across the borders. Then we have what's called Partygate. How many people know about Partygate, the scandal? Nobody? One hand in the back. Did the news media put this on the back shelf? Why'd they do that? I'll venture you to guess. Political media. What we have here is Partygate. This Partygate was against Boris Johnson, the Prime Minister of the UK. And they caught him in December of 2021 at social gatherings in closer than 6 feet together without mask on. That's the golden arrow is pointing to the Prime Minister right there. And now they even came up with a term called Partygate, which is now a Wikipedia term, defined as the Prime Minister being caught socializing, violating all the lockdown recommendations and mandates that he was putting everybody else into, but not himself. As a result of that, at the scandal of Partygate, they asked for his resignation. Did anybody know that? They asked for his resignation. He respectfully declined their recommendation to step down. His response was, and this just happened, in January, he relaxed all the mandates in UK. He got rid of all the moratoriums, all the mandates. No more requirements of wearing masks, no more requirements of being locked down, no requirements of going to socializing in bars, restaurants. All the locks came off. What happened? What happened? What changed in 2 weeks? That we went down from severe restrictive activity and social gatherings and face mask requirements and vaccination requirements. What happened in 2 weeks that's different? What happened in 2 weeks is he was caught in Partygate. And all of a sudden now the UK relaxes all their mandates. We're now up to nearly 25 countries that have no mandates at all. No mask requirements, no vaccination passports. And if the UK is going to relax, what's going to happen to Australia and New Zealand? They got to follow suit. What's going to happen to most of the Caribbean islands that are under UK origins? They're going to relax their mandates overnight. How much have you heard lately about booster shots? Have they just kind of disappeared off the media talk anymore? The booster shot discussion has kind of disappeared, hasn't it? So let's take a little break in the stretch. Let's go get ourselves nourished and rehydrated. Let's talk about the lockdowns as part of the prevention process again. And Dr. Anthony Fauci's statement was that this is an infection that had to be controlled by very draconian methods, namely shutting down virtually every major country that was involved. And then we had this study come out on January of 2020 from Johns Hopkins, a literature review and a meta-analysis of the effects of lockdowns on the COVID-19 mortality. Once again, academic release paper just came out January 2020 about the effect of COVID-19 mortality effect by instituting lockdown policies. The conclusions were that in the United States and Europe, by going to the draconian methods of locking down the society and businesses, the reduced mortality that provided for COVID-19 was only a 0.2% reduction in mortality. For all the economic collapse it resulted in, we got a 0.2% gain on return of investment. And how many people in your hometown did you saw businesses close, small businesses close because of this pandemic? See restaurants, bars, stores, mom and pop operations, terrible. To the tune of the conservative estimate that we lost 1 million small businesses in America alone in the last 2 years. And those businesses will never come back. Majority will never come back. And how it was determined what businesses were called essential and could stay open, as certain, box stores on every corner of America could stay open because they were deemed to be essential, where those that were small business didn't have that power to keep the doors open. Political atrocity, yes. Mail order retail systems went through the ceiling and value and riches and gained. This research reviewed all of the meta-analysis that the shelter-in-place orders were virtually ineffective. So we sat locked up and sheltered in our houses for no good reason and no good outcome to this mortality, morbidity. They only reduced the morbidity or the mortality of COVID-19 by less than 3%. And we went down to doing border closures, school closures, and limiting gatherings. The results of that in reducing mortality yielded a return of 0.1% for closing schools. For closing borders, 0.1% reduction in mortality. Closing schools, less than 5% reduction in mortalities from COVID-19. And limiting gatherings like churches and social gatherings and clubs only had a less than 2% reduction in mortality. We've done a lot of suffering. We did a lot of separation, a lot of breaking up, of getting together based on this pandemic's recommendations. Trying to forward ahead here. In conclusion, this medicine analysis that doing the lockdowns had a marginal benefit at best. Such a standard benefit cost calculation led to a strong conclusion. Lockdowns should be rejected out of hand as a pandemic policy instrument in this situation. Now, again, this is from Johns Hopkins. I'm surprised this got into the journal, got published. So let's look at a population that doesn't believe in vaccine. What happened to them? This is out of Lancaster, Pennsylvania, the heart of Amish country.
When it comes to actions taken to address the COVID-19 threat, hindsight is still very much underway.
Can we increase the volume with this?
Consideration, a story and outcome you probably aren't hearing much about anywhere else. In the heart of Amish country.
Thank you.
Lancaster County, Pennsylvania. Thousands of families lead lives largely separate from modern America. The Amish are a Christian group that emphasizes the virtuous over the superficial. They don't usually drive, use electricity, or have TVs. And during the COVID-19 outbreak, they became subjects in a massive social and medical experiment.
So it's safe to say there was a whole different approach here in this community when coronavirus broke out than many other places.
Absolutely.
Calvin Lapp is Amish Mennonite.
There's three things the Amish don't like, and that's government. They won't get involved in government. They don't like the public education system. They won't send their children to education, and they also don't like the health system. They rip us off. Those are three things that we feel like we're fighting against all the time. Well, those three things are all part of what COVID is.
After a short shutdown last year, the Amish chose a unique path that led to COVID-19 tearing through at warp speed. It began with an important religious holiday in May.
When they take communion, they dump their wine into a cup, and they take turns to drink out of that cup. So you go the whole way down the line, and everybody drinks out of that cup. So if one person has coronavirus, the rest of the church is going to get coronavirus. First time they went back to church, everybody got coronavirus.
Lapp says they weren't denying coronavirus. They were facing it head on.
It's a worse thing to quit working than dying. But to shut down and say that we can't go to church, we can't get together with family, we can't see our old people in the hospital, we got to quit working. You're working, it's going completely against everything that we believe. And you're changing our culture completely to try to act like they wanted us to act last year. And we're not going to do it.
Steve Nolt is a scholar on Amish and Mennonite culture and Mennonite himself. He's studying Amish news publications to analyze community-wide trends.
So are you saying as of about May of 2020, things kind of went back to normal in the Amish community?
Yeah, it's kind of by the middle of May, it's sort of like back to a typical behavior again.
That also meant avoiding hospitals.
I know of some cases in which Amish people refused to go to the hospital, even when they were very sick, because if they went there, they wouldn't be able to have visitors. And it was more important to be sick, even very sick at home, and have the ability to have some people around you than to go to the hospital and be isolated.
Then last March, remarkable news. The Lancaster County Amish were reported to be the first community to achieve herd immunity, meaning a large part of the population had been infected with COVID-19 and become immune. Some outsiders are skeptical, and solid proof is hard to come by.
Even those who believed that they had COVID tended not to get tested. Their approach tended to be, I'm sick, I know I'm sick, I don't have to have someone else tell me I'm sick, or a concern that if they got a positive test, they would then be asked to really dramatically limit what they were doing in a way that might be uncomfortable for them. So we don't have that testing number.
We didn't want the numbers to go up because then they would shut things more. What's the advantage of getting a test?
One thing's clear, there's no evidence of any more deaths among the Amish than in places that shut down tight. Some claim there were fewer here. That's without masking, staying at home, or another important measure.
Did most of the community, at least the adults, get the COVID-19 vaccine?
Again, we don't have data on that, but I think it's pretty clear that that in percentage terms, relatively few did.
Well, we're glad all the English people got their COVID vaccines. That's great, because now we don't have to wear masks. We can do what we want. So good for you. Thank you. We appreciate it. No, we're not getting vaccines. Of course not. We all got the COVID. So why would you get a vaccine?
By staying open, the Amish here have one tangible 2020 accomplishment few others can claim.
We have this joke: when everybody else started walking, we started running. We made more money in the last year than we ever did. It was our best year ever.
Did the Amish really find a magic formula? They say yes, and they don't care who doubts it.
Yeah, all the Amish know we got herd immunity. Of course we got herd immunity. When the whole church gets coronavirus, we know we got coronavirus. Yes, we think we're smarter than everybody. I mean, shouldn't be bragging, but we think we did the right thing.
Okay, the Amish experience. How many of you remember the days when they would have chickenpox parties? The one child in the neighborhood was positive, and they brought all the other kids in the neighborhood on it so they get inoculated. Natural immunity provides 27 times better effectiveness of blocking your infection for COVID-19 than it does getting the vaccination. 27-fold better immune response by getting the natural infection. Just a little hat that you might want to pack into your hat.